Welcome to the Growth Lab, the podcast dedicated to the business of beauty and vitality. Today, we are sitting down with Lisa Butcher, the CEO of Three Sisters Counseling. It's an amazing practice that features individual, couple, and family counseling. Let's find out more. This episode is brought to you by MedSpa Accelerator. We help medical practices and med spa clinics solve the bottleneck of inconsistent, unqualified patient leads to achieve a predictable, scalable monthly revenue without staff burnout. We're absolutely thrilled to have Lisa join us today to discuss the future of patient care and these unique counseling services. Let's get started. Good afternoon, Lisa. How are you?
Good afternoon. Thanks so much for having me. I'm great.
I'm excited to dive into your story, Lisa. I like to frame these conversations simply past, present, and future. We like to start with your origin story, how you got into this demanding and rewarding industry. And then I want to pivot to the present reality with what's working, what's causing friction, what's keeping the doors open. And then finally, we'll look at your future outlook for the next 3 to 5 years and your vision for the future and the biggest strategic moves that you're planning. That way, we'll be able to cover full spectrum of building out a successful multi-location business. Does that sound like a good roadmap?
Sounds like a great roadmap.
All right, great. Well, looks you started with one and you have now expanded to many locations around Canada. What is your secret to your success when you started 7 years ago?
So interestingly, actually, my journey when you talk about past starts prior to that 7 years ago. So I actually worked for 18 years prior to being a mental health counselor in healthcare. So I was a registered respiratory therapist. And most people actually had not heard of that until COVID. And then everyone seems to be aware of what a respiratory therapist is since COVID. But I found myself kind of, I would say about 10 years into my career, really interested in how people's physical health journeys were affecting their mental health. And so I found myself, instead of just treating the patient for their physical illness, I would actually find myself talking to patients and families about how it affected them that they were sick and how that kind of, trickled through the entire family and how it affected, let's say, the kids or your spouse and that kind of thing. And with that, I became really interested in our mental health journeys because of our physical health. And I decided to do a master's in counseling psychology and go back to school to become a counselor. And it's been an amazing journey because when I first started to do that, I actually had been previously married, had three very young kids. They were 2, 4, and 6. Wasn't feeling as though this was going to be the correct path for me in terms of my marriage and all these things. So I actually ended up leaving my marriage and found myself as a single person with 3 kids under the age of 6, starting a master's with a brand new puppy and starting a whole different career. So it sort of backs way up for me. It's not just about sort of starting the clinic. It's actually this whole life shift for me at
Yeah.
basically the age of almost 40. I'm almost 50 now. So almost 40, I completely did a pivot in my career and changed my entire life.
Wow, that is quite a transition. So I guess I want to start with certifications.
hmm
Looking on your website, you have many different certifications from Canada, the ICIB, ICBC, First Nations Health Authority, the Crime Victims Assistance Program, and the EAB and the FACP programs. How are the certifications improving trust in patient care?
They are huge, actually. So I meet a lot of counselors who don't do that. They'll just do private pay. They just want to, they don't want to deal with the hassle of direct billing or third party billing. In the States, they call it in network billing. They don't want to deal with that. And I think that's actually a huge disadvantage for patients. So I like to make it as easy as possible for people to access mental health care. So we are actually a part of every single contract we can possibly be a part of, just to make it very easy for people to. So they essentially come, not worry about billing. We do all of that for them. It allows us to get referrals from those places. It allows us to be searchable by those clients who are looking. So say they had a car accident. For example, ICBC deals with accidents. So if you're in a motor vehicle accident, you get an automatic number of sessions through ICBC, but you have to have someone that's in their network, in their provider network. So we're easily searchable there. So all of those contracts allow us to serve people because of what's happened to them. Crime Victims Assistance Program is another perfect example. This is an organization that allows people who've been the victims of crime and also family members who've been the victims of crime to access a lot of funding. And we are providers for that. So I think it just removes barriers for people.
Wow. Okay. And I'm not sure if a lot of our viewers understand how the Canadian healthcare system works. It's pretty much all paid for, right?
Yeah, so in the healthcare system in Canada, if you were to go to a hospital, it doesn't matter what your physical health background is. You could have any disease, any pre-existing condition. You would just go to the hospital and it's automatically covered in any province that you live in. We have different healthcare coverage, so you just automatically, by living there, you get the healthcare coverage, and then you would just go to the hospital and show your card, and everything is paid for, whether it's surgery or otherwise, or visits. Elective things are separate. So say somebody wanted to get, I don't know, a facelift or something, and it wasn't medically necessary, that's something you would pay for individually. But generally, if you have a healthcare issue, you're just automatically covered. What that does is it removes
Wow.
barriers. It removes barriers for people because it's not about how much money you have. It's not about the connections you have. It's not about the job you have. There are people who completely unemployed also have full healthcare coverage, which is really amazing. And I love that about our Canadian system. So for example, mental health wise, if I was, let's say, unemployed, I had no healthcare insurance through my job, I could just go to the hospital and I could get either physical healthcare coverage or mental healthcare coverage. They do have counselors at the hospital, and that would be fully paid for by our government. But if you want private practice, which is what I'm in, then that usually necessitates you paying. So you would come to us, and that's why we do all of these contracts, because if you've had an accident, ICBC will cover it. If you've had a victim of a crime, Crime Victims Assistance Program will cover it. If you are through your
Oh,
company, your EAP or your Employee Assistance Program will cover it. So that's why we register with all those things to remove all barriers. And then, of course, if you have a job and you have independent health coverage, that's completely fine. You can use your benefits as well.
okay. So it's not necessarily free, but with those contracts, it takes care of that
Yes.
payment component for the patient.
Yes. And we also offer every year, I have students that I take from graduate programs for mental health, and those students will offer pro bono sessions throughout their time that they have to get enough practicum hours. They need to have 400 hours of counseling. So during that time, they'll offer free sessions as well, or very, very low cost sessions, which is also helpful for people who are not part of any of those payment scenarios. But I think the whole thing in Canada is just accessing healthcare, which is super important.
How did you grow to those? Is it 7 locations now?
Yeah, so we actually have right now we have 7 offices, and they're located in 2 different cities. So we have some in Vancouver, and most people have heard of that. For people from the US who are listening, it's right above Seattle, essentially, in Canada. And so that's where we're located. And then we have another office in another location in Kelowna, British Columbia, which most people have heard of because it's on the news every year because it's often on fire because it's very dry. They call it the California of Canada. And
Okay.
it's essentially directly above Bellingham, Washington. So that's kind of 4 hours inland from Vancouver. And I do that because I think it's important to have people access the care in different locations. Some people are more urban, and so they're located, let's say, around the Vancouver area, and that's quite a large city. And then some people are more rural, located around Kelowna, which is a town of about 150,000 people.
Wow. Yeah, because Canada's a big place.
It is a big place. And I think, British Columbia, which is where we're located, is also quite big. And I think it's important to just allow people to have the access when they're looking for it. And we also do online therapy as well.
Telehealth.
Yeah, telehealth, exactly. And so that actually takes patients across Canada in many provinces. I've also done counseling for people in the US because some of our insurance covers our ability to do that, which is also extremely helpful, I think, just for anyone who's struggling to access care.
Wow. Wow. Thanks so much for that. Tell me a little bit about some of your unique therapies that you have there. I want to talk a little bit about the EMDR. How does this work?
So EMDR is called eye movement desensitization reprocessing, and it's a really interesting concept in the way that it's using eye movements to physiologically calm yourself and to process. So if you think back to when you were a baby and you were crying and your mom or dad would rock you, and they sort of just shh, 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 and tap your back, that's
Mhm.
actually a way of physiologically calming down a person. So what you'll notice when people are in traumas, sometimes if you notice a plane crash or you see a bus crash and you'll see people on the side of the road and they're rocking back and forth and they're really, really intensely emotionally distressed, that's because we're actually naturally physiologically trying to calm ourselves down.
Okay.
So what EMDR does is it uses eye movements, and the patient will follow either a light going back and forth, making their eyes go back and forth, or my fingers going back and forth. And essentially what we do is, if you want to think about it like recalling an essay. So you think of your trauma, you recall that. So almost like we're pulling up our essay like a Word document, and then we're going to revise it, hit save, and then resave it. And so what we want to do there is we want to take the original trauma that is causing us physiological stress. We want to reprocess it by creating a calming feeling using eye movements during the recalling of that trauma. And then we're going to hit save and then save it so that way internally it's not affecting us the same way.
Wow, that's pretty interesting.
Hmm.
I like it.
Yeah,
Tell
it's
me,
really interesting.
yeah, tell me a little bit more about the SFBT, the solution-based brief therapy.
So this actually is something that I would say is quite based in my personality. So I have at our practice, it's not just me. We have multiple clinicians ranging at times throughout the year between sort of 16 clinicians up to 20 clinicians across all of our different locations and then in all of our different offices. And everybody has different specialties. So we have registered psychologists, we have registered counselors, registered social workers, and occupational therapists. And we have a pediatrician as well who does autism assessments with us. And the reason I choose such a variety of people with different backgrounds is for their different training and also their different specialties. So when I pick solution focused brief therapy, I'm very solution focused. So I would say personality wise, if someone was coming to me for counseling and many other therapists on my team, I kind of am of the belief that you've already talked about the issue with people, right? You've already sort of gone to your girlfriends and gone out for dinner and been like, God, what do you think about this? And you've told them, and you've gone out with your buddies and been like, I'm really struggling with this. So it hasn't worked, right? You haven't been able to solve it and you can't really move past it. So you come to counseling, and although it's great to talk about the reasons things are happening and understand them, and I think that's really important, it's also really important to find a solution to them. And I'm not saying everything is fixable, but you want to kind of leave a counseling session with some tools. And I'm very tool focused, very sort of when between now and the next time I see you, let's try 1, 2, and 3. And I give people a stepwise solution. So solution focused brief therapy is specifically looking at solutions to certain things. It's a method of therapy and there's a whole process to it. But I think people get to sort of choose what type of therapy they would like to do. I do often steer people away from what they think they might want. Some people will read something on the internet and they'll be like, oh, I definitely need this. And it's just not the best therapy for what it is they're going through. So I do encourage people to be open to what the therapist is saying. But most of the time, people love solution-focused therapy.
Okay, wow, that's really great. Thank you so much for telling me about that. It's very interesting. I never knew about that therapy before.
Hmm.
What's the biggest goal of the business in 2026 in this year?
The biggest goal of the business in 2026 is I'm actually doing an entire rebrand this year. So what's basically happened in the last 7 years is I don't have a business background. I mean, I literally, as I said, I was a mom. I was working in healthcare. I don't have a background in business. My undergrad is actually in kinesiology. And then I did a master's in counseling psychology. So for me, it's not like I have these sort of business ideas or how to scale a business or how to grow. So I've sort of, let's just say, thrown 18 things at the wall at one time and seen what has stuck. And so for this year, it's actually about creating structure. My personality is not super systems oriented. I wish I was very systems oriented, but I honestly, people who know me will say I don't do the same thing twice in the same way. It makes me very spontaneous and it makes me an entrepreneur and it makes me very adventurous, but it isn't the best for replication and duplication and being methodical. So the goal this year, after growing to the size that I've grown, essentially without the underlying systems that are reproducible, is creating systems. So I've already started to do that. I've got all my policy and procedure manuals. I've got systems for hiring, systems for offboarding, everything to do with the business side of it, looking at metrics, all these things that I'm not great at. I was not excellent in grade 10 math, and so I don't look at metrics often, but I've started to do that. So I've also just signed for 5 more offices. So I'm going to be looking at rebranding and expanding those and doing some significant marketing in terms of what we offer and hiring even more therapists.
Okay. Great. Wow. All right. That's fantastic. Now that we've focused on, kind of gone over the origin story, and obviously you got a lot of things that are working for you, I want to kind of shift to the other side of the coin of where the strain and the chaos shows up. So tell me a little bit, if you're looking at the current patient acquisition process, what's the first point of friction or strain that you or your team feels every day?
I would say our main goal, obviously, is to help as many people as possible. That's the reason for the number of offices. That's the reason I'm constantly hiring practitioners, because I don't like the idea that someone actually gets to the point where they're sitting on their couch at 7 p.m. at night. And actually, the biggest time for people to book counseling appointments is between 7 p.m. and 2 a.m.
Mm,
So I don't like the idea that someone would be sitting at home being like, I can't stand this anymore. I need help with this. And they reach out and no one answers the phone. They can't get anyone to call them back. There isn't an appointment available for 2 weeks. So I would
yeah.
say the biggest thing we notice is people saying, "Oh my gosh, thank you so much for answering the phone. Thank you so much for booking me in. You have no idea. I've tried all these other practices and no one's taking clients." Mental health is a huge thing, and a lot of people struggle with their mental health. And I think it's the accessibility that's important. So we've actually implemented quite a few things in terms of and things that we can actually have people be reached immediately when they reach out, even if we're not answering right away. So I'm trying to remove all those barriers.
Such as an AI receptionist?
So we have basically, as soon as you call, it's an automatic AI receptionist, except it's not a robot. It's my actual voice. We previously had one that was a robot, and even myself just listening to it, I felt like I couldn't breathe. I was like, people cannot hear this. So I changed it to my voice. So it's me, and it's very calming, and it's, asking them what they're looking for. And then actually, if we miss that call, you'll still hear my voice, but then you get an automatic text message saying, if you're wishing to book or you'd like to change your appointment, here's the link. So automatically people are clicking on that and going ahead and booking. It just removes that, like 4 o'clock in the morning, someone tries to book, boom, they get a message and they can book. And it's amazing the number of people we're seeing that are booking in after hours, which is awesome. And then the other thing that it will do is direct you. So if you want to reach our Kelowna office, you can press a certain number, our Vancouver office. And then we also put a second parameter in there where people can reach their actual therapist. So there's different extensions for each therapist we have. So if someone is directly looking to leave an exact message for that exact practitioner, they can do that by pushing that number, and they don't have to go through an admin so that they have to explain what's going on to the admin. They can just talk directly to the therapist.
Wow, that's pretty impressive. What if the therapist is unavailable?
Then same thing. So they can leave a message for the therapist. The therapist gets an automatic text message or email, and then the therapist can connect with them. But at the very least, they have that booking link so they can actually book in with that person.
Wow, that's great. And it looks like you're really taking the approach from the patient's perspective, really really on the personal side, like as if you were in that situation and you needed to speak to a therapist, and you're really looking at it from the other side of the coin. And I think that's really important when delivering effective patient care. And like you said, really coming down to accessibility.
It is. And where that comes from, I think actually is my background in healthcare. So I worked for so many years in the hospital system, and you hear all the time, Mr. So-and-so in room 25 is so angry, he's so mean, or, someone will say something about a patient, let's say in a hospital setting. And when you go, you realize that person who's mean or angry is just scared. He doesn't want to be there. He doesn't want to have cancer. He doesn't want to be struggling. And he's just angry that he's there. It's not about you. It's about how he's feeling. So I feel like I really got that when I worked in healthcare for so long. And so I've brought that into the mental health scenario as well, is people are just struggling. They might say something mean, or they might treat you badly or be annoyed, but actually it just comes from them being stressed, them being overwhelmed. And as soon as they hear that friendly voice and they have access to care, they're immediately calm. I've actually answered the phone before, because the phone not only rings to my admin, but it will also ring to a secondary system on my phone just in case it gets missed. And, I can ignore it if I want, if I'm busy, but automatically I know that someone's being cared for and it's going to multiple locations. And I've actually answered the phone before when I'm just sitting doing nothing, and I think, oh, okay, well, I'll just answer the phone. And I've had people start crying right away, like, thank you so much for answering the phone. You have no idea. I've been trying to get a hold of someone for 5 hours or 5 days, and I'm just looking for someone to see my daughter. I think is exactly the point of having a mental health counseling practice.
Yeah, absolutely. Really great answer. Thank you so much. If you could eliminate one time sink or a repetitive task that distracts your most highly paid staff, like the counselors, from delivering on patient care, what would that be?
I would say without a doubt, this is the easiest question for me to answer. It's charting. So
Charting.
yes. So then that's actually another thing we've implemented AI with, is that and it's up to the counselor's choice if they want to use this. I find it hugely effective because charting takes a ton of time. So when you have an hour-long session with someone, you have to think of the number of things people tell you, right? And if you're just talking about your overwhelm with school, or, just some generic thing like, I'm kind of struggling with time management. Okay, maybe there's not a lot that has to go in a chart. You might just say, person is struggling with time management, help them go through some strategies for better effective time management. That's
Mhm.
all you would write in a chart. But if someone comes into you and they're talking about sexual abuse or domestic violence, or a robbery that happened at their house, or something more serious, AI for me is extremely important. And there's a lot of people who are afraid of the use of AI
Mhm.
in their actual practice because they think, oh my goodness, am I being recorded? No, you're not being recorded. Basically what it does is it'll actually hear the conversation, and then it takes notes based on what is said. And what I love about that, and nothing's recorded, what I love about that is that actually at the end of a session where someone tells me something really serious, I have dates that they said, I have exact things that happened, things that I would have missed as a human. And so
Yeah.
eventually when something goes forward, maybe to court or something like that, the court will often request notes for something that's serious. And if that's the case, and it's always, up to the patient if they want to release that. But then I have actual dates, like, when did this occur? How did this happen? Who was involved? That kind of thing. And I might have missed all of those things if I was doing it naturally without the help of AI. So I think those things are really, really important. And charting is the biggest, I would say, hindrance for counselors, because you can see 8 people in a day, but that also means you have 8 people plus hours of charting afterwards,
Wow. Yeah. Yeah.
right?
Yeah. I can definitely understand that. And if you have some AI programs or some assistants that can speed up that counseling, you can get the work done faster.
Exactly. And so this way, I'll see 10 people in a day right after one another. They're 50-minute appointments. And as soon as I'm done within 1 minute of the session, it'll generate an entire AI note. And I just go over it and make sure everything's correct. And then I click save, and it signs it automatically digitally from me. And that's hugely helpful because for counselors that don't use it, and there are many in my practice that don't because they prefer to just write it themselves, it takes them at least 20 minutes to do a note. And then, it affects the number of people they can see in a day because they obviously have to take time for themselves and also to do the notes.
Yeah. Great. What systems do you have in place to turn a first time consult? Maybe somebody's coming in for, DV or family counseling or couples counseling, to turn that one time patient into a long term, high value patient who returns for multiple treatments throughout the year.
That's a really good question. So we offer free consultations, and I feel like there's a lot of counselors just in sort of our business, let's say, not in my practice themselves, but just in general, that will see someone for a consultation and they listen to what the person's looking for, and they don't really sell themselves in the way that, they just kind of listen and they're like, okay, well, I can support you in that. And that's a common phrase used in counseling. I can support you in that. I feel like I need to offer more than support. I don't want to support you in exactly where you are. I want to support you in moving forward, and I want to actually be the facilitator and help you get those steps and strategies. So for me, I think what I look at is the way in which that I can do that.
What systems do you have in place to turn that first
Yes.
time consult into a long-term, high-value patient who returns for multiple
Yeah.
counseling sessions throughout the year?
Okay. So what I like to do in the consultation is I will not only sort of tell them what it is that I can help them with and how I'm going to help them, but I get them booked in for their sessions right away. So I say, okay, on average, I think it would take, let's say, 4 sessions to really get to the bottom of that or to help you with that. So let's get
Mhm.
those sessions booked right away. People appreciate that because what ends up happening is they will book one session and then people's lives are busy and they're overwhelmed. So then they leave the session and they don't have another one booked. And then 2 months later, they realize they're not doing well. And they're like, oh, shoot, I forgot to book a session. So I make sure multiple sessions are booked. You can always cancel them, but I think it's better to have it and not need it than need it and not have it, is what I always say.
Mhm.
The other thing is we have a lot of things on our website and in our marketing in terms of barriers people have, sort of drop down menus, frequently asked questions. What is this going to help me with? Why should I engage in counseling? What is it going to look like? I do a lot of media things involved with describing what it would be like. What happens when you first come in for your first appointment? What is that going to look like? What's the person going to ask you? Those types of things. So I think preparing someone for what it's going to be turns them into a long-term client. And the other thing too is that just because you're coming to a counselor for one session for something, let's say you have anxiety, doesn't
Mhm.
mean you don't also have other things that you can talk to the counselor about. So for example, someone will come to me because they have and then in talking about that, we realize that they come from a divorced home and they've really struggled because they didn't grow up with one parent or the other, or a parent had addiction. And then we realize that that actually impacts how they show up in their own marriage and their own trust for people and those types of things. So there's actually a whole host of things that someone can see someone for. And I do encourage people to think of counseling as a long-term sort of constant check-in. Even if you just check in, let's say once a month or once every 4 months or once a year, I think it's a good idea to check in and just make sure that everything you're doing in your life is propelling you forward in the direction that you want to go.
I would definitely be doing that if I had free healthcare in my country.
Exactly.
Well, that has been a fantastic breakdown, Lisa. And thank you so much for being so candid about the operational reality. The website is Sisters Counseling. We're going to have a link in the description below. And we've covered a lot of ground today, from your origin story to the future of your counseling business. And I know that our audience will get immense value from this. And with that, we're going to go ahead and wrap up the recorded portion of the Growth Lab.
Thank you so much.